The concerns this evening around Chris Hani Baragwanath Hospital seems to be coming under fire for either medical negligence or what is called avoidable deaths. It's been revealed that over 900 babies died from avoidable incidents at the hospital between 2020 and 2022. Now, the hospital's maternity ward also has 50 medical negligence claims to the tune of 1 billion rand. For more on this, we're joined by Dr. Aslam Dasu from the Progressive Health Forum. Doctor, thanks so much for joining us. So it's a very interesting terminology, and perhaps you can help us. So 1,565 neonatal deaths since 2020 at Chris Hani Baragwanath, but the Gauteng Department of Health is saying those were not, none of them were due to medical negligence, but 909 were due to avoidable incidents. So what is the difference between medical negligence and these so-called avoidable factors?
Good evening, Sally. Good to be with you. Look, it is terrifying when you read the headlines in this way, and it is more nuanced, and I'm glad you've asked the question. So Chris Hani Bara sits at the end of a series of health facilities through which especially antenatal care is delivered. And by the time you come to Chris Hani Bara, you presumably are going to deliver and that your antenatal care has been adequate. Now, it's not always the case. Here's a hospital that can deliver up to 30,000 babies a year on average. And you know, you have an appreciable number of neonates that do die. And there's a number of factors involved here. Many of these babies are born already compromised. That means that there hasn't been adequate antenatal care, or the mothers have arrived too late, not necessarily the fault of the mother, but there's no ambulance, or they live very far away. So the social determinants of this problem are very significant. As far as the clinical responsibility goes, Chris Hani Bara is under enormous pressure, as are all the hospitals in our province and around the country. And that's a direct, approximate cause of which is the inadequate administration of our hospitals with such provincial governments who should make sure they are properly staffed, adequately equipped, properly managed, and so on. And they fail practically on every one of those metrics. So what you have is an overworked, overburdened professional staff component. And the same staff who got us through COVID at the cost of over 2,500 lives of their colleagues, they did so because they went above and beyond the call of duty, because the administration did not come to the party, so to speak, but they got us through. Now, that will have, you know, consequences. People leave. Now there's more work for fewer staff, and there's going to be patients falling through the cracks. So the 900 figure you give, a lot of those, yes, avoidable deaths. That means avoidable if you do the necessary in terms of the entire pregnancy. It could be avoidable if you don't provide proper clinical care at the moment of delivery. But I would suspect that that is a minority of cases, not the majority.
So I was reading an article in News 24 which says that avoidable is issues such as perhaps not enough beds, hypothermia, inadequate infection control, which all speaks to the layers of protection within a hospital. So what you're saying is essentially avoidable deaths can be in part due to just a lack of resources, whereas medical negligence is someone really failing to do their duty. I would imagine, though, that an avoidable death, you could probably still sue that hospital?
Sure, or the health department, or whoever is the responsible legal...
And you know, it's still a death, and it's still a failure on a different level, isn't it?
Sure, certainly. Let's not gloss over the fact that our hospitals run at suboptimal management levels, and that our health workers do what they can under trying conditions. However, if you have a bloated administration that can't even ensure the supply of food. And this is happening at Chris Hani Bara right now.
Yeah.
For the
Yeah.
last 3 weeks, patients haven't been adequately fed. That will have a deleterious effect on their clinical condition. Now, who takes responsibility for that? It's not the hospital staff. They provide over 11,000 meals a day, and they don't have any protein to
Yeah,
give
well, just to
to.
interject on that one, just to update from yesterday, we spoke to the Gauteng Health MEC, and she said it is in part the suppliers who are saying, well, you haven't paid me at this other hospital, I'm not going to deliver to Chris Hani. I put it to her that infrastructure issues, supply chain issues at a massive hospital like this, should be absolutely running like clockwork. She's vowed to get to the bottom of it. She acknowledges there's a problem. But of course, we know this was a problem in March last year still already. So there are just so many problems. It's easy to just sort of not want to engage at all because there's so much going on. Where do we start?
Sure. And I think your last point is important. I think it's overwhelming, even for this MEC who's come in, and she's not a health professional by any means, but as a political head, she's not going to want to admit to her administration failing. Yet that is exactly what it is. I mean, Gauteng is the poster child for this hospital dysfunction. As you know, we've been going through this for years. These problems develop over years, and they become deeply entrenched. And it will take years to remove us from this chronic situation. However, there's certain basic functions, because we've been running hospitals for 100 years. There are certain basic functions you don't compromise. Now, if your supply chain can break down on the provision of food, imagine how much else it breaks down on, and why there are so many avoidable deaths, avoidable morbidity, how many lack of beds, shortage of staff. So it's happening at the entire administrative interface, and it's not a hospital problem. This is a government problem. So it's not adequate, it's not tenable for them to deflect and say, well, this is the supplier's issue. They should have had, as you quite rightly put it to her, they should have had adequate due diligence that the supplier will be able to supply and will continue to do so. And if there is a shortage of payment, that will be addressed expeditiously so that the system doesn't break down. No, in our instance, they let the system break down. Then the MEC reads a report in the newspaper that's very unflattering and rushes to the hospital and then tries to do a deal with the supplier who supplied some food, but it's on sufferance.
And it's
Here's the money.
It's someone with the best will in the world, I think, trying to sort of put out these fires, which really shouldn't be occurring because these systems need to be in place. And I think it's just one more sign of the many layers of problems that need to be addressed in our health system. I just want to thank you so much for speaking to us this evening and also explaining that there is a difference between those deaths that are avoidable and medical negligence. But of course, still answers need to be given. Thank you so much, Dr. Aslam Dasu from the Progressive Health